going to the American Lung Association and then getting that pamphlet that shows the lungs in different stages of health. And I remember like putting that on my father's dressers because I thought magically that would change his mind. If he saw that the lungs looked this bad, he's going to like quit smoking. And of course that didn't happen. And so of course, now we know that when we're talking about addiction, it's just very difficult for people to quit smoking. And it takes many, many attempts for that to happen.
Hi friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Marcia Zorrilla. Marcia is Director of Positive Youth Development and Public Health Specialist at Stanford University School of Medicine. She has over 25 years of experience as a health educator and a combined 27 years of experience developing the clinic's Youth Advisory Board and providing nutritional educational classes at Juvenile Justice Centers. She conferred a Bachelors in Animal Sciences at Cornell University, Master of Public Health and Community Health from New York University, and a Doctor of Public Health at Loma University, and is certified as in addiction and recovery counseling. In today's episode, you'll hear and learn more about why working at the intersection of youth mental health and substance misuse is so important, the work that she does around youth advisory boards and why they play a crucial role in public health, providing valuable insights and empowering youth to become advocates and leaders, why taking time for oneself is essential for maintaining mental health and overall well-being, especially in public health, why program planning is a valuable skill in public health, enabling the development of effective interventions and initiatives, why finding the right fit in a graduate public health program is so important, and how you have to research schools, talk to alumni, and really do things to get a better sense of the program, as well as engaging with youth in a non-punitive way and creating spaces for learning and teaching together is crucial in substance misuse prevention, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
My name is Marcia Zorrilla, and I am a public health specialist and director of the Reach Lab Youth Action Board at Stanford School of Medicine. And I'm happy to be here, and you're listening to Public Health Careers.
Well, welcome to the show. I'm so excited to hear more about your experiences and what got you to the work that you're doing. But before we dive into any of that, how do you identify and tell us a little about your personal background?
Sure. So I am first generation Latina. My parents are from Cuba. And so we were born and raised in New York, myself and my two sisters. And after I got married, my husband and I, we lived in New Jersey, and then we moved to San Francisco, which is where we live. And we've been here now for 30 years or more, actually, a little over 30 years. Raised our 3 kids here. And that's kind of, that's my little story.
Yeah, and I'd love to hear a little bit more about your little story as well. So what was that like, maybe transitioning, coming to the US, being first generation, and then even so like transitioning from the East Coast to the West Coast for you?
Sure. So my parents were born in Cuba, and they met in New York. And so all of us were born in New York. What I would say the challenges for sure was living 2 different types of society. So we're talking about kind of living the Cuban household, but you're living in the American world. So that was really challenging. So trying to negotiate those 2 spheres growing up was quite challenging. My parents, they spoke very little English. My mom actually spoke more than my father in terms of like getting us out there in terms of, making sure that we had healthcare, we had, good schooling, those kinds of things. So even in her English, and it was a pretty broken English, she really, did a lot of things for us. She really was a strong advocate for us, for sure. And my dad was in the restaurant business, so his English was very, he didn't speak a lot of English, and knew a fair amount of English, enough, in terms of restaurant menu kinds of things, but primarily, spoke Spanish, and we spoke Spanish at home. And so we went to school with actually in a really diverse neighborhood. To be honest, it was I went to Catholic school as a kid, and we had a lot of kids that were from like all different ethnicities, race. We lived in a real Haitian neighborhood, Puerto Ricans, Dominicans. It was, it was fine. For a brief moment, moved to Miami twice, and then came back to New York. Went to high school in New York, and then it was after high school that things started to get difficult in terms of trying to decide what it was that I wanted to do and all that. And so that's where, I could keep going on in terms of like my kind of like my trajectory going from then to now. It was, I loved working with animals, and I thought for sure I wanted to be a veterinarian. So I had a really difficult time trying to figure out my major. That's the kind of thing. And I'm very careful when I ask students those kinds of questions, because I remember what that was like for me. So I was pretty sure I thought I would be a biology major, but I didn't like it. I did not like being a biology major at all. And what I did like was more the hands-on. And so I became a vet tech. So I actually went to a community college called LaGuardia Community College. And it was there that the veterinarian who went to Cornell, he was the one that really was pushing me to go to Cornell and study animal science. And that's how I got involved in animal science. And from there, I decided that I didn't want to be a vet. I loved my major. I loved what I did. I loved what I studied. But I wasn't sure that I really wanted to be a veterinarian after all. And so I became a vet tech
Okay.
again, but with horses. So I was an equine vet technician when I graduated from Cornell.
Well,
So.
thank you for sharing that. That definitely paints a lot of context for going into the conversation, and I could only imagine the challenges that your family had to overcome for you to be successful and for them to be successful. And it's really awesome to kind of also hear that your mom was kind of like the advocate for your family, and I could imagine how maybe looking back on it, how that kind of impacted and wanted it to get into like public health week. But we'll learn a little bit more about that in a little bit. And we'll come back more to the community college and the vet tech and the animal sciences. But before we get there, I wanted to ask, because you have a lot of experience with like over 15 years of experience in health education. I wanted to hear if there was like a memorable moment that made you grateful for doing the work that you're able to do.
Most definitely. I would say that my very first time taking students on a field trip was a very memorable event for me. And the way that was memorable was I had a small group of students. This is when I worked at the clinic, and we were going to present at a conference in Southern California, which was called the CAP conference, or the California Association of Peer Programs. And when we went there was probably like 200, 300 youth, and they were all going to be doing workshops and all that. And it was at that moment, like, it really hit me, the power of peers and peer health educators. And it was at that moment that it really solidified for me that I really wanted to continue working in this field, and definitely working with peers and peer advocates. It just really was amazing. And it was an amazing experience also for our youth, not only for the fact that they were also going to be attending and presenting, but for many of them, it was the first time they were ever on a plane. And it was, so it was really life-changing for several of the students that went on that field trip. So I've never forgotten that.
Well, I appreciate you sharing that story with us, and I'm glad that you were able to experience that and give those kids that opportunity to also experience something that probably exposed them to a whole different perspective on like what life can give you. So that's awesome.
Yeah, definitely going beyond your neighborhood, that there's a world out there. oftentimes when I worked, especially when I worked at the high school, I heard of students never even going to the beach. We have a beach in San Francisco, the Ocean Beach, and none of them would ever go to the beach. And so it's really nice to be able to kind of give that opportunity to students to kind of go beyond their neighborhood, and just like there's a huge world out there, and let's look at all the different opportunities that the possibilities that are out there for you. So I like that part of it.
I love that. And you're director of positive youth development and public health specialist at Stanford University School of Medicine. I wanted to hear more about why is it important to have youth advisory boards and the role that they play.
For sure, the youth are the ears and the eyes of what's happening with their peers. They know what's happening. And we, as people that work with adolescents, we have an idea, but not like the youth, like the youth that are living it. And so what they do is that they really enrich the work that we do. And it's not only just that it has an impact on our work, it has an impact on us as providers, or as people that work with youth, but it also really impacts the youth themselves. It really changes them. They develop more confidence in working with adults. They become better public speakers. They become better advocates. They learn how to work with a community of like-minded folks. So it's really an incredible opportunity. And I think that any agency, in any setting that does work that involves youth needs to have youth as a youth board. And that's going across anything and everything. Whether you're working in an organization that deals with adolescent law, you should have a youth advisory board. If you're working anything that has to do with the juvenile justice system, you should have a youth advisory board. So I just think it just makes the work so much better for the youth, and that's really what the goal is. So I feel really strongly about that.
I absolutely agree with that. And I'm glad that you're an advocate for this. I know that sometimes organizations have challenges with working with, engaging with youth, especially like authentically. Are there ways that you have seen or that you've done that have been able to kind of bridge that gap?
You're not kidding about that part, that it takes a bit of time for adults to get used to working with youth. And so there's a way for us to kind of grow and evolve with how that would look like. And also for us, for people that are working with youth, is to really remember, well, what was the purpose? What was our purpose in having a youth board? It was not just to hear their voices, but really to act on what it is that they were talking about and what they were expressing. So giving youth the freedom to be able to speak their mind, and for us to be able to implement their ideas is really empowering. And so that is, for me, the ultimate, that you definitely listen to what they have to say, but also act on what they have to say. And it just makes the place better for everyone.
Absolutely, because we oftentimes forget that youth have a voice and we kind of like marginalize them in that way. And I think it also gives the opportunity for youth to kind of engage in leadership and understanding how to be in like cohorts or like coalition with people and what that looks like. And it's also a great learning opportunity for the adults, because on some youth boards that I've been on, it is a challenge for the adults to really like create that space for the youth to kind of speak up and be messy sometimes, because of course they're not professionals, of course they're figuring it out, and many times they might be figuring it out as they're saying it. And I think you have to be okay with that and create that space to just let them feel safe in being seen around.
Most definitely. And the other part too is, I mean, that processing that needs to happen sometimes, you have to really be patient, as an adult, or kind of like the coordinator, director, whoever is leading any kind of youth program, but really being patient and having, with the processing that happens, because you're exactly right. I mean, they are all trying to figure it out, and they might be doing it at that very moment. So I think really, being patient, going back and forth with ideas. I think that's really helpful.
And before we get more into the animal science and going to Cornell University, what does public health mean to you?
So I'm going to say that I did not know what public health meant to me when I was before public health, before I even got my MPH and all that. It wasn't until, and this is really the truth, I was in the New York City subway system. And this is probably in the late 80s when the whole AIDS crisis was happening and all that. And I don't know if you've ever been to New York City and seen the subways, but they have all this advertisement on top. And I'm just there sitting and I'm like, just like reading all those advertisements, all these different ones. But there was one that caught my eye, and that was, and I don't remember the name of the person. At the time, what I do remember was that she was a doctor, an MD, and she was from the Department of Public Health in New York City. But she had something behind the MD. She had an MPH. And I was like, MPH? What's that? And so that's when I decided that I wanted to do research on what that meant and what is an MPH and what does a person with an MPH do. And this is before internet, before, Google and all that. So going to the library or going to a bookstore or those kinds of things. And that's how I found out about public health. It was reading about what is it that a public health professional would do, and I became interested in that. So now when I think about public health, I think a lot, of course, populations. I think about prevention, and I definitely think about the social determinants of health. What are the areas that make it very difficult for people to have good health? Is it accessibility? Is it, structural racism? What is that is happening that is hampering people from benefiting from good health? So that's what I think about when I think about public health.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at thephmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. And taking you back to that when you were in the library and you were looking up like what public health was and it piqued your interest. What about it at that point piqued your interest?
So I would say that I knew that I liked health, but I wasn't sure that I really wanted to deal kind of like with the aftermath, kind of like, and it's great for people that are into that, and it's totally fine if you're into wanting more into kind of like the chronic disease. But that wasn't something I was really interested in. I really was more interested in preventing people from becoming sicker, and so that is when I was reading about it. I was like, oh, that's a good idea, in terms of, for example, I think the one that comes, close, well, and especially in my household, was smoking, because my father was a smoker and smoked cigarettes. And so even back then, I remember going on a field trip, going to the American Lung Association with my school. So field trips are really important. So that's the one thing I want to say, because it did have an impact on me. Going to the American Lung Association and then getting that pamphlet that shows the lungs in different stages of health. And I remember like putting that on my father's dressers because I thought magically that would change his mind. If he saw that the lungs looked this bad, he's going to like quit smoking. Now, of course, that didn't happen. And so what, of course, now we know that when we're talking about addiction, it's just very difficult for people to quit smoking, and it takes many attempts for that to happen. So, so I would say that that was like an example of wanting to prevent people from getting deeper into any kind of so for my example of tobacco, getting deeper into tobacco or in cannabis, which is the work that we're doing, the work that I'm doing now as well. You don't want it to be seen as, let's see, how do I want to say this? Just don't want it to, I would like for people not to get worse with their health outcomes. If they, experimenting is one thing, but to actually become addicted to a substance, that's really when we start to see really poor health outcomes. And so that's kind of like where I wanted to shift my work, was more into prevention. There's a lot more that I can say, but I think I'll stop right now with that.
Yeah, I appreciate that. So you lead it into a little bit about your journey into your bachelor's degree. You said you started off in community college. You had an interest in animal sciences, and you completed your bachelor's in animal sciences at Cornell University. So can you just walk us through that thought process once again?
Yeah. So I when I graduated from the community college, I went straight to Cornell. And again, really encouraged by the veterinarian at the time, who went to Cornell and really was encouraging me to continue with my studies, especially if I was thinking about going to the veterinary school. And so I went to Cornell, and again, loved my major, really enjoyed it. It was very hands-on. The classes, there were some challenging classes. We had to take, organic chemistry and biochemistry, those kinds of chemistries. And that was, those really hard classes,
Yes.
really hard classes. And that's sort of like what made me think that, maybe this is really not, not something that I'm interested in doing. And for other people, that's great if that's what you like to do. And kudos to you. And so when I was at Cornell, one of the things that I did that I really enjoyed, and this was again kind of like it was accidental, is that I was taking an equine science class, and we had this veterinarian come to our class, and she was doing independent study on these horses called the Przewalski horses. These are the Mongolian wild horses. And so she was looking for people that would be interested in learning more about doing horse behavior, like horse observations and all that. And that they have these horses in various zoos throughout the country. And that they had one in the Bronx Zoo. And so then I was like, oh, okay, I'm going to go and talk with her. And I just had a, chat with her. And I said, oh, I live in New York City, and I would love to be able to do that in the Bronx Zoo. So that was my first experience doing research. So I did horse behavior and just did a lot of observations and all that. And she provided the training and all that. And so for my, so a senior thesis came out of that. And so I wrote a paper for school. It wasn't published or anything like that, but it was really simple at that time. And that's something that I tell students too, that if you have an interest in, like a genuine interest in something that a professor is talking about, that you should approach them. And it was very, very easy to do at that time. It was very simple to do. So I was very appreciative of that, very, grateful. And that was Dr. House. So I just want to put her out there. She's still at Cornell. And the other thing that I would say in terms of, because I was an animal science major, we had a lot of classes with labs, and they were 3-hour labs. So I learned kind of like the hard way that you can't possibly take 3 classes with labs, because then you really just don't have any time for yourself. You're always constantly studying, and this, Cornell could be a really challenging place to be. And it is, even now it's even more challenging from people that are there right now. So my last semester at Cornell, I had a kind of like a lighter load. I only had one lab. And it was then that I decided that I wanted to do something, like really get involved with something like a club, because I was not involved with any of that. And so I joined the equestrian team as a beginner, and because they needed beginners as well. And it was not a big deal back then. And I joined the equestrian team, and that is the one thing that if I could have done all over, I would have joined the equestrian team right away. And I would have learned not to take 3 labs in one semester. And that is something I tell students as well, is that do not overload on labs, because it really will take away a lot of the kind of the time that you need for yourself. You really do need to make sure you carve some mental health time and some stress-free time, so that so that you could continue with school and be happy. So that's something that that's the only thing that I would change. I did have a lot of great friends at Cornell. I'm still in touch with many of them. I lived in Risley Hall, which was a very interesting place to live. Back then, it was a co-ed dorm, and that was almost unheard of. Co-ed bathrooms, but of course private. But it was a really nice environment. I really liked the people that I met there, and I'm still in touch with them. And then my last semester I lived in a co-op with other women, and that was also a fun experience. So I'm still friends with one person from the co-op, my roommate. So I really developed really nice friendships at Cornell.
That's so important, and I think
It is.
especially when you're doing like this health saving types of roles, it's so important to develop the habit of setting time aside for yourself, having hobbies and things that are outside of the work that you do, because we are so much more than just the work that we do.
That's
So I
right.
think it's really, I'm glad that you're highlighting, like, yeah, I was part of the equestrian team, and I wish I did it earlier, and because these are the experiences and the connections, as you say, that we really cherish.
Yes, absolutely. You really do need to make time for yourself. And it's not, I don't know, I'm hoping that things have changed a little bit, that it's not seen as frivolous or greedy to take time for yourself, because you really do need to take time for yourself. So I'm glad that it seems to be changing, but it's really hard for us to really take care, all of us, to take care of ourselves. And I think that's really important, that we need to pay better attention to that.
Absolutely.
Yeah.
And after your undergrad, you went on to get a Master's of Public Health in Community Health at New York University. Tell us about that thought process of pursuing a MPH degree.
Yeah. So there was a big, well, I wouldn't say it was a big lag, but by the time I was done with my bachelor's, I got married 6 months later, and then I started working in it actually was working in research animal science, which I did not like at all. And then I switched to an equine clinic, and then so something personal happened to our family. So my mom developed a brain tumor, and during her illness, I would say that it woke me up. It woke me up in the sense that it affected us all differently in my family. But for me, I'll just speak for myself. What it did for me is that it woke me up the realization that life is short. Life is really short. And you really need to take advantage of what is it that you want to do. Like really, really try to figure that out. Like, what is it that you want to do? And at the time, even though I like horses and all that, I didn't really like working where I was working. I didn't like, I didn't feel safe working where I was working with sick horses are very different from well horses. And so I was just like, I don't want to do that. And then all of us kind of became my mom's caretaker. So there's a lot of changes that happened in our home. But during that process, what I did is that I became a pharmacy tech. I worked in a lab. I mean, it was just like kind of like trying to figure things out about like, and at the same time, when you're dealing with an illness that is, that, with a family member that has an illness, and there's such a big unknown. You're not sure if, how things are going to progress. And I remember there was a point that the neurologist told us, let's kind of like take a break. In some ways, it's sort of like, we were all like in this hyper vigilant kind of, it was just so intense, and so it was sort of like that gave me a little bit of pause to kind of like, okay, maybe think about maybe animal science grad school. I actually took some classes in macro, micro economics, agricultural economics, because I was thinking, well, then maybe that's where I should go because I have this, animal science degree. But I didn't last with that thought either. And I was at Rutgers. And I met a lovely person there. I believe she might have been the dean, because at that point I was really just not doing well in my classes. And I spoke with her. And then I found out her partner had a brain tumor. And so we just talked so much about that. And, one of the last things she said to me was, I hope you come back to school. And, I thanked her. She was such a lovely person. Anyway, so it was around that time that's when that whole MPH thing came up in the New York City subways. And that's what kind of like led me to that decision that, okay, I'm going to go and look and search that out. And I needed a program that was in the afternoon. And so what's really challenging and this is, I think it still is too, that a lot of schools, especially in the master's or PhD programs, they really expect you to be kind of like a 9-to-5 kind of student, like that this is your life. And I had other things happening, I had to take care of my mom, but I also had to work. And I just could not negotiate that. And so what was really great about the program at NYU is that it was a kind of like a late afternoon, evening program. And so that flexibility, it was really meant for adults that were working adults. And it's like that was like one of the best things that could have happened. And so without a doubt, and I've told this to many people, NYU changed my life. It really changed my life because it was at NYU where I found my calling. That is where I found that I love public health. I like the idea of being a health educator. This is the work I wanted to do. And so that's what happened.
Well, thank you for sharing that. I'm sorry to hear about your mom. And I'm glad that it sparked something in you. And I love that you shared that entire story because it kind of highlights, I think, what many people in public health or like searching for maybe public health kind of go through is like, what do I want to do? And even in finding like, because you're like, I like animals, but actually working with the animals in this type of way is not something that's fun. You switch around to different roles. You then started to like just test out, take classes, try to see like where you definitely fit. Found public health on the subway, dug more into that, and then like to the point of finding your calling and becoming a public health professional. And I think that is something that we see oftentimes in current day as well. And I could imagine just how much harder it was for you to find public health back then as opposed to it is for people today. And still people today have a challenge in finding public health. So
Yeah.
I'm glad that you were able to highlight that. So
Yeah.
going into the program, what were you maybe like thinking, what would you do afterwards, or did you have that idea, or like how did all of that progress for you?
Yeah. So, well, I have to say that when I finished my MPH, I knew I wanted to go and get a doctorate. I knew. I just really liked it a lot. And I thought I would want to be a professor. And I just really loved it. And so I worked for 1 year in New Jersey, actually, at the medical school. And that was because I had a contact from one of my professors at NYU. So networking is really important. I can't even stress that enough. And I'm not saying that you need to have a network with thousands of people. I mean, just need one or two people. That particular professor, I had asked her, and she gave me the names of two people. And this is, again, before internet, email even. I called, had to use a phone, called, and I was lucky that one person that I called, they called back. And then I was able to get an interview, and then that's how I started working. And it actually was an agency. It was a project from the UMDNJ, which is what they used to be called. I think they changed the name of the medical school. But I worked in Perth Amboy in a really small project, and it was alcohol, tobacco, and other drug prevention program. And what happened, what led me to California was my husband's job. So he had a feeling that there was going to be layoffs happening. And so he started exploring other options. And the other option was finding work outside of New Jersey. In San Francisco was one of the places that opened up. And so when we found out that he got the job, then we left shortly thereafter. But when we found, well, during that process that he found out that he got the job in San Francisco, I had to figure out, well, what's going to happen to me, or in terms of my profession. And I was pregnant with our first daughter. So I was, and this is also true, I was reading an article about school-based health centers. And after I read that article, I said to myself, this is where I want to work. This is where I want to be. And again, being very old school, picked up the phone, called San Francisco. I somehow was connected to and at that time I did not know that, the only school-based health center in San Francisco, and got to speak to the director of the clinic, who became my boss eventually. But that is how that happened. So from moving from New Jersey to California, and then starting work shortly thereafter as a health educator, where I wound up staying there for close to 25 years.
Well, thank you for sharing that. Definitely gives a little context into how you got there and the health education work that you were able to do as well. Would love to hear if there were any like big takeaways from your MPH program, or any like lessons that you want to share with us.
So definitely with the MPH program, we heard this so often, and now this is why we was talking about the social determinants of health. So how everything was related to our social economic status, and at the time, the example that was given, that, because I was in New York, and it was during the talking about the AIDS crisis, that you could be in one zip code, and then you just go up another couple of blocks at a different zip code, and the health outcomes of people are vastly different. And this is just in a couple of zip codes in one city. So that was a huge lesson for me as a public health, as an MPH student. The other one was learning about hepatitis B, and at the time it wasn't really a big, not like right now, how youth have to be immunized for hepatitis B, but back then not everybody was immunized. But I remember that there was a guest speaker that talked about hepatitis B, and I assure you that right after I heard that talk, I got that vaccine. So those are two particular takeaways for me. I guess one other one I just thought about was the program planning class that I took, I really enjoyed that in terms of developing program, and that really actually helped me a lot in terms of developing future programs, which led to working where I worked at the clinic. And program planning, I think, was really one of the best courses that I took in my MPH program.
Very practical course, and I definitely think we can all benefit from that kind of course.
Yes.
But I appreciate you sharing that. That's very, very helpful. So you graduated, you are shifting to the other side of the country. You get a health educator role. Can you tell us more what you did in that role, and then maybe that transition, or maybe that thought process of you thinking about getting your DrPH?
Sure. So when I was working at the clinic, I started off doing tobacco control, tobacco prevention with youth, and because if you think about a school-based health center, so we are a clinic within a high school, and so I would always thought of myself more as a community health educator, because our school is a community, and so what are some ways to keep our community healthy and healthier? And so that was so my first project was on tobacco, so tobacco prevention, doing groups, doing awareness campaigns. So this is in the early 90s. And then shortly thereafter, I got laid off. And then I came back to do work in teen pregnancy prevention. And so we created a program that was a peer program where youth would bring in a peer, and we would talk about healthy relationships, birth control. Our clinic provided birth control, so one of the unique features of that clinic was a very comprehensive clinic with medical, mental health, or now called behavioral health, and in health education. It's just very comprehensive. And so I did that program for several years. And then we had another different program that had to do with nutrition. So that was for a few more years. And then we went back to family planning, and kind of another comprehensive teen pregnancy prevention initiative that was actually from the state, and did that for quite a while until funding ended. And then we had another kind of like another shift, and that's when the youth advisory board was developed through this other small grant that we received. And this is a huge initiative from the Kellogg Foundation and the State Association for California. They were one of the recipients of this grant, and so we also were the recipients of the grant from the California Association. And so that was the role for me then, was to teach about minor consent, the law, and develop a youth advisory board, and really to promote school-based health centers. And that was for 5 years. So I just want to also clarify too that at this time I was working part-time. So having 3 kids, I was very lucky that I was able to work 20 hours a week. Especially when my son was born, my second child, it was just very difficult to really put in those 40-hour per week. It's very challenging, and also challenging being that we didn't have family around. So I was really very lucky, very fortunate that I was able to do that. And so because that's important when going to grad school. So it was when I was, so that must have been that was in 2011 that I decided that I got into the DrPH program. But prior to that, I really was, again, trying to find a school that was the right fit for me and for my family. And it was the same kind of situation. So UC Berkeley, again, only wanting people that would be available in, that the 9 to 5 kind of situation that is like, I just cannot do this. I'm working and all that. And I remember going to one of those American Public Health Association meetings. This is why going to conferences are important. And and this is when I was an MPH student. And I remember going to all the different tables, looking at all the different programs that they had there. And one of them that made an impression on me, but it's just put it in the back of my mind kind of thing, was a program at Loma University. They had an online program even back then, or some type of computer program. It was just something very different from all the other schools. And it was something that I was just like, oh, that's pretty interesting. And I remember saying to the person, you should do this for the doctoral program. And at the time, they only had the MPH program. And so that was something that I kind of like put away, that, okay, I'm gonna have to put that idea away. I can't find the right program for me. So many years later, we had an intern at our clinic, and she was going to Loma Linda. And then she was showing me how they were doing it online. And she was an MPH student, but she told me that I think they have like a doctoral program. I don't remember. She said, I think, or you should look into it or something like that. And that is how I found out that they indeed had a doctoral online program in health education, health promotion and health education. And so then that's, I applied, had an interview, and the rest is history. I got in, and I started the program in 2011. And again, just being very fortunate to have a very incredible clinic coordinator, different one from the previous one, Michael. He just totally was able to, we were able to work it out. And I'm just so grateful for that opportunity. Yeah.
Well, shout out to Loma Linda. I think that's a good little promo for them, and I
It
think
really
like,
is.
right. I think it also just speaks to the power of connecting with organizations at conferences, because as you said, like you had that interaction. You said, "Hey, you should really think about this for your doctoral program." Maybe that was the thing that got them going, and they started building that out, and then even learning how you learned about it is like not directly looking into the program, but just having someone around you that was in the MPH program and kind of spoke to it. That is truly awesome. And I'm glad that you were able to find a program that would be able to cater to the needs. And I think that's something that's very important, especially for many people in public health, is like, how do you, I don't want to say balance, but how do you like navigate the school work life type of skills and things that you all have to do?
It's so true. And especially when you become when you're a parent, and or if you're taking care of your parents, and there's so many factors, and it's really nice to be able to, and now there's so many online programs, which is great. I mean, and they're all accredited programs. I made sure that Loma Linda was accredited. That was very important to me. Accredited through the Council of Public Health Education. So I'm really wanting to make sure that the programs that I participated in as a student, that they were going to be, that I was going to be able to get a job, and because my program was accredited. And so that was very important to me, for sure.
And were there any memorable moments that you had during your DrPH program?
Well, it was really interesting because there are many of them, but the ones. So again, just having like a small group of friends, and you can become friends with people online. Clearly, I think we've seen that now more than before. But it was really the people that I met. They were just like really nice people. My fellow peers were really great. So it was great to have that support, for sure. There were some professors that they really really liked, that I thought were very kind. Some of them already have retired. The I feel that the program really prepared me in terms of quantitative work. It was very shocking sometimes, the amount of quant for a DrPH program. I was expecting that more from a PhD program. But and I took 9 courses that were very quant heavy, research heavy courses. So that was a surprise, but I did fine. I did fine. The I think the other part that the dissertation process is very isolating. That is really the point where you do feel very alone, and you are, but especially the kind of like in the Zoom world or in the online world, you really feel especially alone. So having connections with other people. So I had like another friend that she was also working on her doctorate, and we went to different schools, but it was just sort of nice to be able to kind of have someone to talk with and check things out and resources, those kinds of things. So that was really helpful. It was, and I think the other part of when you're in grad school is that we have like these really grandiose ideas of what our dissertation is going to be and the research and all that. And I think that's normal because, we're in grad school and this is like our time and we want to do something like meaningful, impactful and all of that. And so my first research project did not work out. And so that was like huge disappointment because I lost a year. So that was really, it became too large. It was going to take years to do something that I thought that I could do. So that was like a real letdown. But then I found my other project, and that worked out. That worked out much better and actually more meaningful for me, given where I am right now, working on mental health literacy and among young adults, and what are young people's health-seeking behaviors when it comes to seeking mental health services. And I want to share the story of how that came about. So what happened was that one of my son's friends, he died by suicide. And I remember it was like kind of like talking with like other moms, like other friends that knew this young man. And from that conversation, it really kind of hit me that, is there a way that we could learn about how people can see the signs of perhaps some type of depression or anxiety? Are there some signs that could be helpful? What are some ways that we could learn about what young people are thinking when it comes to help seeking? Like why don't they go and talk to somebody? Or what are some things that we could learn from that, that experience? And that really was something that was, I really think that was really what I needed to do. And that is how I kind of like shaped my, my dissertation research along those lines. And they really, that is kind of like what led me to working where I'm working right now in terms of, substance use and mental health, how incredibly intertwined those two issues are. So that's, so that, but it was a long haul. It was, 6 years in school, and I have, my family, they were amazing. My husband and, my kids, and, it's a lot of sacrifice and all that, as well, as you could imagine. But the, at the end of the day, I'm glad that I did it because I really did want to do it. So my advice for anyone that's doing a dissertation, keep it small, and the kind of like there's a saying that a good dissertation is a finished dissertation. So do not let go of that. Keep your eye on the prize and finish that up.
That is absolutely correct, and that's what I've heard from many people on this show before. That is definitely taken into the consideration. You don't have to fix all the world's problems in your dissertation. You just have to get your dissertation done. So being cognizant of that is very, very important. And I think you also highlighted the point of how important it is to have an accountability partner, especially when you're doing your dissertation, because as you said, it's isolating when you're doing this work. So just to have someone to chat back and forth with is helpful. So appreciate you sharing that.
Most definitely.
So coming out of your DrPH program, were there any big takeaways that you wanted to share? And then you were an adjunct faculty at Montclair State University. So tell us about that role.
Yeah. So going back to like what I was saying about, developing relationships. So a different professor at NYU now works at Montclair State University, and her name is Lisa Lieberman. So shout out to Lisa. And she was my advisor, and she's also just a wonderful person, wonderful instructor, teacher, professor. And so she knew I was doing the DrPH program. She knew I was doing it online. And so when COVID happened, she reached out to me to see if I would be interested in teaching these courses online. And I was very excited to do that. And I said, yes, I would love to do that. And so I've been doing that ever since. So the last class that I taught was asynchronous, which was perfect. And it works out also for students, having that type of a schedule, having a schedule where even though you're still on Zoom, you still may need to meet at 5 p.m. And so that sometimes could be challenging for some students. So I prefer the asynchronous model as an instructor, but also I think it also helps students to be able to commit to the program. And people can learn asynchronously, and it all depends on how the materials that you present to the students and just the different educational tools that you use. And you definitely can learn online. So that's how that came about to be.
Awesome. And maybe were there any challenges or lessons learned on teaching and maybe like teaching virtually as well?
So there's for sure there's challenges. So I've done in-person teaching. So before the pandemic, and then after the pandemic, also did in-person teaching. So definitely I think one of the hardest parts is the classroom interaction is nice. It's nice to be able to see people's faces and to be able to do small, especially doing like the small group work. I think it's so much nicer in person than trying to do that on like a Zoom room and all that. It's just sometimes it works and sometimes it doesn't. So there were points that I kind of didn't really do the Zoom groups that often because I didn't. It just was too awkward. I'm not entirely sure. And it was like early in I think now it's actually better because now people are more accustomed to it. But in the beginning, and it was about a year after, I think it was in 2021, 2022, when I was teaching online, that people were still kind of new at it. So not quite sure how to get into the group situation and all that, and how to kind of interact with each other in group. And then having no cameras on and just seeing the black boxes, that part took a bit of getting used to. And I would say that for the most part, grad students did keep their cameras on. Undergrads, they mostly kept it off. And so that part I think is a little challenging because then I'm like, how engaged are you really? So that part was a little, a little challenging, but I do believe it's gotten better because people now know how to interact, more comfortably on Zoom.
Yeah, absolutely is a challenge. Thank you for sharing that.
Yeah.
And in your current role, you are the public health specialist and director of positive youth development at Stanford University School of Medicine. Tell us, how do you come across this role, and then what do you do in it?
So, so earlier we talked about, relationships and networking and all that. So when I was working at the clinic, we had an independent researcher who was doing an evaluation, and that person became the professor at Stanford School of Medicine. And so when I was starting to look out, branch out, trying to figure out kind of like my next steps after grad school, after my DrPH program, I reached out to her and I asked her if she knew of any openings, and not really being very sure if there were any openings. And she told me, let's talk. And so we talked, and she was telling me that she was thinking about this particular position, and I was very interested in it. And so it was, I feel very fortunate that I was able to take on that position. So what I do right now is we have a youth action board. So I'm still working with youth. These are youth from across the country, because when I started, it was in 2019. So it had a couple of months before the pandemic hit. And when I established the Youth Action Board in January of 2020, and we were in person, and then we were online. And that really just changed, kind of, changed everything. And for everybody, right? And so it grew. Having this Youth Action Board, it grew in terms of numbers and what they were working on, because our focus, the lab's focus, is prevention, and it's substance prevention. And we develop a lot of curriculum. So these are free curriculums for teachers to use, and it's open to anyone, online, free, multiple languages. So we have it for tobacco, we have it for cannabis prevention, and then we have a comprehensive harm reduction based curriculum. And so the youth, what they do is that they help us with the content, and make it more youth friendly, even adding topics. One of the topics that the youth came up with, and this is during the pandemic, because I remember this very clearly, how much they were talking about stress and stress management, and wanting ways of feeling better, and mostly this is what they were hearing from their peers, or ways to feel better that did not involve using substances. What are some activities that they can do? Things like that. So that was really important. So that was actually something that we added to one of our curriculum, and they kind of helped start that process with us. So in addition to that, I'm going to be involved in the evaluation of one of our curriculum that has to do with students that have been found using substances, so alternative to suspension curriculums, which is called Healthy Futures. So that was one of the first curriculums that I was involved in. One of the we had a consultant, and his name is Ira. And between Ira and myself, we came up with this alternative to suspension curriculum called Healthy Futures, and we received funding, and we're going to be evaluating the curriculum for the next 3 years. And I'm excited, so happy about that, because a lot of people are going to really, really like that, because that's something that's missing. We need to find out ways of educating youth about this, educating them about substances, but also ways of dealing with addictions, and what is it that we can do, just in terms of the effectiveness of that curriculum. So I'm excited about that.
That sounds like you're doing a lot of great work, and it seems like the work is like, as you're saying, is in this overlapping intersection of substance misuse and mental health, and then I guess with the overarching umbrella of youth in there, which I think is important. And definitely, if those results for that evaluation are publicly available, feel free to share that with me. That sounds like it's fascinating, and I think that it's so important that we find different ways to engage with youth that isn't maybe as punitive as prior systems have been, and really creates a space where we can like learn and teach them together.
Most definitely. A lot of places are still very punitive. Students are still being suspended. That doesn't help the students, doesn't help them academically, doesn't help them mentally. So if we can have this type of a program instead of suspending them, it would just make it'll make it better for everybody, especially the youth. So, yeah.
Absolutely.
Yeah.
And in your work, what do you like most about your role?
Well, as you can imagine, you're working with the youth. That's I really enjoy the work that we do. Over the weekend, we had a youth summit that had to do with fentanyl awareness, and it was really the idea for that came from the youth, and it just really was amazing, and I believe that it accomplished a lot, and we hope that there's going to be some follow-up in terms of what the takeaways that people, youth and adults, what they took away from that youth summit. It was really fantastic. It went really, really well. So I definitely love working with the youth. I love my colleagues. I love working with my colleagues. They're very they're creative. They're really smart. They're fun. So the environment as a lab, I feel like it really helps us kind of explore ideas and grow professionally. And I think also being at Stanford, there's a lot of opportunities for professional development, and so that is something that I really take advantage of. I really enjoy that part of it as well. So, and I feel like the work that we're doing is that we're doing a lot of good, and we're really doing a lot of our reach is really large. We recently did some data collection, and we found that at least 4 million students have accessed our curriculum or have learned from our curriculum, and so that's huge, and it just keeps growing because it was like 3 million when I started, or towards the end of the pandemic, and so it just kind of keeps growing and growing, and so that part is very meaningful, to me, that the work that we're doing is really having an impact. So I like that.
I'm glad to hear that, and I hope that it continues to have that positive impact and reaches many, many more youth, because we know these are challenges that are existing today and are going to still be here tomorrow, and we need to continue to find solutions and create information for people so that we can have better outcomes.
Yeah, most definitely.
And before I move you on to the Furious Five, I'd like to ask, where would you like to see yourself in the future, and where can people connect with you?
Well, in terms of people connecting with me, they can connect with me through LinkedIn. So be happy to share. I mean, it's my first name, my last name, LinkedIn. Pretty simple. So that's definitely one way that you could reach out to me. In terms of like, what do I see myself doing in the future? So I'm a lifelong learner, and I don't see myself, even as I get closer to that retirement age or that retirement period, I really don't see myself really stopping too much, to be honest. I do want to say that I would love to continue in some aspects working with youth. I would really like to be, and I would love to be able to help others that are wanting to like establish a youth board or learn more about school health. Being a consultant, it's something that I believe will be part of my future. Staying teaching as an adjunct, I think is that's worked out really well for me. I really like it, so I hope I could continue to do that. I love mentoring students, and that's something that I also believe that I could continue doing. And the other thing is we're writing a book. So my former colleagues from the clinic and I are writing a book, and not just about our experiences, but also really incorporating the youth views and how is it that the youth that we know from the clinic that are now social workers, or they became a nurse, or they became a therapist, or they're in grad school. How did that happen? And so we, what did we as a clinic, as a staff, what is it that how do we help nurture that? And so we're excited about that, that the book that we're writing right now. So that's going to be, yeah, that's our little project for right now.
Well, that's an exciting project. I look forward to the release of the book, and definitely share that with me so I can share that with my network as well.
Oh, thank you. Yeah.
Yeah. And then moving on to the Furious Five, the 5 questions that I ask all guests.
Okay.
Number 1, what advice would you give to a student trying to pursue a career in public health?
I would say definitely research the schools that you're interested, making sure that it's the right fit. If possible, talk to people that went to that school, like reaching out to either alumni or trying to reach out to current students. I wouldn't say you don't need to get 10 opinions about one program in one school. Kind of keep it small, just for your own sake too. It gets, how things start to get diluted and all that. So just to kind of get in a sense of what that program looks like. But definitely, like, really trying to find the right fit is really important.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Well, I would say that in terms of a person's kind of personality and all that, is just to be somebody that that likes to collaborate with others, somebody that likes to grow, and somebody that is interested in being, because we are a lifelong learner, and then that environment kind of really creates, it supports that, being a lifelong learner. So if that's something that that you see yourself wanting to do, also being very flexible, having kind of like that mindset of being very flexible. Things are always constantly changing, and being able to work with a lot of different people, from your immediate group of coworkers, all the way to educators that you might be training, or even like the larger systems as well. So sort of kind of like a well-rounded person. Yeah.
Number 3, what's something you're working on improving in your life right now?
Well, so as I was saying, the book is a big part of what I'm working on right now. The other part is getting ready to leave for a trip. So I'm going to be traveling to Portugal. And so that's something that I think is going to be part of my life, to make sure that I keep traveling, having one large trip every year. Um, I think especially the pandemic and my own health issues have really given me that realization that we really need to take that opportunity while we can. So I encourage all of you to travel if you can.
Yes, safe travels.
Thank you.
You're welcome. Number 4, professionally, do you recommend anything?
I do. So because of where I work and what I do, there's a book that or an author that I would recommend. He's he was a reporter, Sam Quinones. So he's written several books that have to do with drugs in this country. So the one that I just finished reading was called Least of Us, but it's a follow-up to another book that he wrote, which is called Dreamland. And I would highly recommend reading both of those books, just to get a sense of how it's not just about the fact that, we have drugs coming into this country, but also sort of like the systems that are in place that is creating these situations. So, And at the same time, it's also promising to see what communities are doing to help people that are using substances.
Well, thank you for those recommendations.
Sure.
And last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I would say try to find a mentor. And that might be, and it's really hard to even, like, especially for young people, it might be very difficult to kind of like, oh, how do I find a mentor? And I would say go to people that you admire, that you work with, that you find on LinkedIn. See if they're interested in kind of like doing a little informal chat with you. But really, or even if you're a young person in you're part of a group, a student club, try to connect with the adults and learn more. So I think that would really be helpful. That would have been helpful for me. Put it that way.
Yeah, absolutely. Those learning and reflecting are sometimes the best lessons that we have to share with others. So I appreciate you sharing that. And I appreciate you coming on and sharing your entire journey. It has been quite a joy to learn about your journey and learn about the work that you're doing. So I greatly appreciate it.
Yeah, well, thank you so much, Omari, for having me here.
It truly is my pleasure. So, housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to hit the subscribe button if you have not as yet. Leave a 5-star review and share this with a friend. Greatly appreciate you all. See you all next week. Peace, everyone.
Bye.